Hello, this is Sharon Burch, the founder of New Directions for Nurses and LiberatedNurse.com. We teach nurse coaches, consultants, and educators how to grow thriving businesses. Welcome to the Respectful Marketing Tips for Caring Nurse Entrepreneurs event. You know, I often hear nurse entrepreneurs say they need more customers, but they feel awkward and uncertain when offering their services. So I've assembled a panel of nurse entrepreneurs to share their experiences and best tips with you. I'd like to introduce today's guest, Dr. Karen Avino. I've invited Dr. Avino to this event because she is the co-owner of the world's largest nurse coaching education program, the Integrative Nurse Coaching Academy, also known as INCA, and the professional organization International Nurse Coach Association. In addition to being the executive director of education for INCA, Karen consults with healthcare organizations to help them integrate holistic nursing and nurse coaching into practice to create more optimal healing environments. Karen taught holistic nursing and integrative health for 20 years in online and on-campus classes at the University of Delaware. She is a distinguished scholar of the Global Academy of Holistic Nursing and has received many awards as a nurse educator and mentor. She has over 40 years experience in maternal child health, nursing administration, community health, holistic nursing, and nurse coach practice. She is board certified as both an advanced holistic nurse and a health and wellness nurse coach. Karen is also a Reiki master, a stress management instructor, and a heart math, clinical meditation, and imagery practitioner. She served as a member of the American Holistic Nurses Association's Board of Directors. She's an author and editor of Holistic Nursing, a Handbook for Practice, and the core curriculum for holistic nursing. Karen is a peer reviewer for the Journal of Nursing Scholarship and Holistic Nursing Practice journals. I don't know how you do all this, Karen. And in addition to running a fabulously successful business, she's an international and national speaker on holistic and integrative topics. So welcome, Dr. Avino. I'm so thrilled that you're here with us today, and I'm really looking forward to talking with you.
Thank you so much, Sharon. I was honored for you to ask me to be here.
So you and I know each other a little bit through our work with the American Holistic Nurses Association, and I'd like to help the audience get to know you a little bit today too.
Okay.
Let's start out by wonder if you would just let them know where you live and what you like to do for fun.
Oh, gee. I live in the state of Delaware, and that's in the mid-Atlantic region. What do I like to do for fun? Gee, I love to walk on the beach. I love to be with my grandchildren. I think bringing the children's play back into your being is to me is just really brings a lot of happiness and joy.
Absolutely. You're so blessed to have them.
7.
Do they live near you, or are they far spread apart?
We are scattered throughout the East Coast, so I do a lot of driving.
Well,
but yeah, it's nice. We still see each other a lot.
I'm really glad for you.
Thank you.
Well, as a nurse in business, I think it's important that we how do I want to say this? For me, it's important that I'm clear on what success means to me in business. And I'm always fascinated by what success means to others. And so as a successful nurse entrepreneur, I'd love to hear how you define success for yourself.
Sure. Well, you mentioned business. So there's, I guess broad statement is there's 2 sides to you, really, right? There's the professional side, and then there's the personal side. As a nurse coach, we tend to look at the 8 dimensions of wellness. We use an integrative health and wellness assessment tool. And I think that really success is defined by having a balance in all of those aspects of yourself. That if you have that and you're content with that, then you feel good and you feel happy about your mission in life and where you are. If I can help others, as nurses, we know that that's probably the core of what's driven us right into nursing, is that we have that, that draw to be able to help others in ways that, are meaningful, right? So we want to have a meaningful contribution to others in our lives. And just, feeling satisfied with that. If we can re-energize nursing practice, that even satisfies me more, especially with the state that we're in right now with nursing. I think having the ability to help nurses realize that they have great potential for themselves, and taking that step on their own is possible, that they don't have to rely on others for their paycheck and do tasks that they're not necessarily, well, they're doing tasks now that aren't even really nursing in the hospital. So my daughter, who's a nurse, she texted me yesterday and she said, so we were adequately staffed, and of course we're not allowed to be. So they took away our tech. And what do I have? I have a patient with bed bugs. So what am I doing? I'm bagging the clothes, cleaning the room, scrubbing down the mattress, and so even housekeeping isn't available for help when somebody on a critical care cardiac unit could be doing a lot more advanced skills.
Yes.
Using it, right? So
Yes.
We're in an area now where nursing needs a focus, and we need to be able to vocalize and speak our feelings and emotions, and also to say no to things.
Yes.
So re-energizing nursing practice would give me great joy in my life, and I would feel successful professionally if I'm able to contribute to that.
Yes. Well, my hunch is you are contributing to that every day, and I'm just so inspired by what you and INCA are doing. Now, would you like to share a little bit about how you came to INCA? Because I know you didn't start that organization, but you've been playing a major role, a significant role in it for many years. And then now you're the owner. Is there a little summary you'd like to share with us about your journey?
Oh, sure. Well, my journey, I would say I've always been a holistic nurse, right from when I first started in nursing. And I had that focus, working with in really labor and delivery and postpartum and nursery, and then eventually helping to start a NICU. It was something that I realized when I could see the power of the mind over the body in moms who were, and especially when I had my first baby and used progressive relaxation and imagery, and all of those things to really help me get through an event with pain, right? And once I started to realize the power of that, it just became something that I was so interested in. I wanted to learn more and more. So continued my journey in discovering other complementary therapies. I taught Lamaze classes. I also was an entrepreneur from the very beginning. So had my own practice teaching not only Lamaze, but also parenting classes, because I was certainly interested in helping new families with those topics. So it was something that I think, holistic, you're just holistically based from the beginning. And so as that continued my journey in holistic nursing, I came across one of the things that I was a lifelong learner about was I came across integrative nurse coaching. And when I realized that I could be an integrative nurse who practices complementary therapies, I realized that that's really, for me, it became the framework for delivering my holistic care. Because when I tried to, verbalize or communicate what is a holistic nurse and what is it you do, it turned into a 5-minute kind of sermon about, what it is I could do, and, the different therapies and the cost for that and all of those pieces. Where now I'm an integrative nurse coach. I practice complementary therapies. This is my fee, and whatever happens in the session, any kind of therapies or whatever, can spontaneously occur. And so I think that finding nurse coaching really made me realize the full scope of what I could do as an entrepreneur. And so Barbara Dossi and Susan Luck first began nurse coaching, wrote the textbook on it, helped to establish the scope and competencies of practice. And they really started as pioneers in holistic nursing also. And so their journey was an interesting one. And I was a university professor and in charge of continuing education and distance education, for online learning for the School of Nursing. So I had that vision of how to expand a business. I knew how to do it. I knew all the components of it and what needed, to occur for that to happen. And so here I am today. I'm now one of the owners of the business, the original owners and creators, paved the way and stepped aside and said, this is now your journey. And I was, more than happy to take that over. So pretty much, that's been the journey in holistic nursing and nurse coaching and getting started in the business. And it's the scope is so broad, and there's so much that has to be done in order to really validate nursing, holistic nursing and nurse coaching in practice. And so I'm excited to be on that journey.
I'm so glad to hear that, your story and your roots as not only a holistic nurse, but an entrepreneur from a long ways back.
Mm-hmm.
And you used your specialty and your personal interest. Sounds like you merged your personal interests and your professional training and skills into your first business. And then you continued to do the same
Mm-hmm.
thing in your current business.
Mm-hmm. Yes, and I've not done any of this alone. I have to say that when you find a supportive team of like-minded individuals, that makes all the difference in the world.
Yes, yes, it really does. Well, would you like to tell us a little bit about the benefits of nurse coaching education for nurses who are thinking that they'd like to have their own business and serve the public directly? What could integrative nurse coaching education give them?
Oh, sure. Well, I just want to start by saying that I think integrative nurse coaching certainly sets you up for private practice, but it also doesn't have to be private practice. I think there's definitely a place for it in your present position and your job, and to bring that in to where you are employed, and you can actually make a major difference where you are. I can give you some examples. Like, we certainly have people who are in private practice and have started their own business and been very successful at that. We'll talk a little bit more about that, but also bringing it into where you are. So, we're in the midst of, and I'm hoping on the down curve of this pandemic that we're in, but we have nurses who they are working in a hospital in Brooklyn, New York, and it's one of the areas where a lot of the COVID patients in the beginning were brought. If you remember, it was kind of started in that region of Westchester, New York, and they didn't even know what was wrong with these people. So some of the nurses, we had no protective equipment. They're caring for patients. They contact COVID. Some of them were in ICU, on ventilators. Some died. They were being exposed, and it was a bad situation. So that hospital, actually, one of their holistic nurses became an integrative nurse coach, and she's the one working with the nursing survivors on their health and wellness, and not just to increase pulmonary function, but bringing back all of those aspects, those dimensions of life that that make you want to live, and to give you that feeling of success in your life and contentment. So, I mean, that's just a simple story where people are bringing it in. And another nurse in her hospital is the employee health department, and nurses who come in who were with anxiety, stress, and all of that are being seen by the nurse coach, and for stress management. And she's doing group self-care classes for nurses in the hospital. And then, of course, our private practice nurses this is their way, if you will, out of the system, where now they're able to not only practice nursing, but practice it in a way that they believe in. So that lifestyle, health, and wellness, the core of nursing practice as health promotion, can truly be provided to clients. And it's a really great profession, I think, especially now, because COVID has woken people up and said, if I'm not healthy, I'm not going to make it. And also knowing that we no longer can just walk into a healthcare provider's office and ask for the magic pill and leave and do whatever it is we want to do on the outside. We have to have self-responsibility for healthcare. And so this is something that a integrative nurse coach can help with.
That's very exciting. I'm a nurse coach, and I went through a different training program, but I'm a big believer in nurse coach education. And I wonder if you'd like to speak to how much growth you're seeing in terms of nurses choosing this path.
I will say it's enormous. It's an enormous opportunity. We certainly have nurse coaches across the United States, but also we're in 17 different countries now. So this is not just a phenomenon in the United States. This is globally. We are really helping to help nurses, because nurse coaching it's about communication. So it's using communication skills that help to motivate and engage people in their own care, right? We know that the communication skills, we know that creating a healing environment for people, creating this sacred space where people can come and be able to share is such a critical piece of this. If we don't really allow those things to happen, like listening to the patient's story in the beginning, we'll never truly understand perhaps what the barriers are to that person being able to take the first step in the care that they need. So, a good example is if a healthcare provider sends a client and they say, this client is non-compliant, and we no longer use that term. I want to be clear. It's about being engaged in the process, right? So if they're not engaged in their process, we have to figure out why. And so unless we listen to the patient's story and try to really help them discover for themselves why that's a barrier, we might need to address that barrier first before that person can even then take their first step on, helping their own health.
Yeah, absolutely. And they sometimes the person can't even receive the additional information they need to hear until that they see a way around or through that barrier.
It's about understanding vulnerability. We know vulnerable populations, they have all these multi-factors that interfere with everything. And it's like a cycle of continued, and we have to be able to break into that cycle and be able to then steer them in a new direction. And we were just the facilitator and the guide. we don't have to be the expert in everything because we help the person discover for themselves the answers.
That is a huge, I'm glad you brought that up because that's a common misunderstanding about nurse coaching, isn't it?
Yeah, we think we have to be the expert in all these diseases, and while education can play a part in it, we also can just give the client resources. And one of their homework assignments is, to explore this topic. Here are some resources. Next time you come back, let's talk about what you know now. And so it's really helping them to become, again, motivated and engaged, but also to be an advocate for themselves.
That can be life-changing.
Yes, it can.
Well, thank you for that. What would you like to share with the audience in terms of tips or ideas to help them feel confident when they make their offer rather than feeling uncertain and awkward?
Okay, so they're, in business trying to get themselves going, right?
Yeah.
And again, communication is essential. So I believe communication coaching can help with communication skills alone. So even if you don't think you have a coaching business, you're going to be doing coaching in your business. So it's an important skill to have. But your first offer, is something that you have to think about taking the first step, right, in your business. I mean, if we back it up a little bit more and say, what is it that, how do you identify what it is that or what value you can give, right, to someone?
Yes.
That's like an important piece of it. But I think we have to understand that in business, we don't have to be perfect. We just have to take the first step, right? We are enough. A lot of people think, I don't have all my ducks in a row and I don't have, this done or that done. It'll come, you don't have to have an enormous business to get started with something. And so getting started with something then even helps you identify more where your target's going to go. So if you want to try to identify, how you can communicate with somebody, like the first step might, be to just try to understand more clearly who your target audience is. We can't do that, I don't think, without understanding even what your own personal passion is. Because if you don't understand your own passion, your business is not going to be successful. That's my belief system, is that you need to be so engaged in business that if you don't understand what your own passion is, so you got to take that first step. I mean, we use this tool. It's called Ikigai. And it's
Yes,
a
I know that
Japanese,
tool. It's lovely.
yeah, it's a Japanese word, really, which, you go through the process of asking yourself, what is it that I love? What is it that the world needs? What can you be paid for? And what are you good at? And that will help you identify what your passion is, both professionally. You can bring in certainly your mission, your values in life, all of those components. But unless you understand your passion, that you've got to do that. Then you're really in a good place to be able to try to talk to that particular population, perhaps, and see what their challenges are and their experiences are, to help you understand what their needs are, right? So in a sense, you're doing kind of a needs assessment.
Yes.
So these focus groups, you could even put up a piece of paper in, a community area, focus group for this. I want to try to understand more. And you want to try to understand what the current state is with them, and then what their ideal state is.
Yes.
So you want to try to help them achieve that ideal state. And so that's an important piece to bring in. And then, what's the scope of your business? What is it that you're going to offer? How are you going to offer it? Why are you going to offer it? What pieces are you offering with that? And then I always think we call it an elevator speech. From that, you can try to, down drill to what's your elevator speech? If you had just a minute with somebody, what is it you're going to say? And nurses might want to think about, if you're in the elevator at the hospital and you're with the chief nursing officer, what's your speech going to be, right? How are you going to sell yourself to them? How are you going to sell yourself to the person on the street that you run into who might need coaching? Somebody who calls you on the phone that wants to come see you in private practice, what's your elevator speech to them? So you want to try to, have some sort of an anchor type of statement or question to try to, draw that person into the conversation, with them. So if you do that, I think you'd be pretty successful at trying to, develop this elevator speech and get started with that.
That's sound advice. I have used that approach myself, and it's similar to what I teach in my education program. It's easy for us to forget that homework, that there's a lot of preparation to do before we make the offer. And if we haven't done the preparation, then of course we're not going to feel confident when we make the offer. That preparation, as I heard you describe it, it's a lot about listening, listening to our own passion inside, what drives us and lights us up, and then listening to the person that we want to serve and asking them where they're at now, and then what do they desire as their their desired state. And then again, listening to ourselves, can we help them? And if we can, as simple as offering it to them. And doesn't have to be any more mysterious than that, does it?
No, I mean, it's a broad kind of statement you might make, and then a very broad question to try to draw them into the conversation, right? It has to be personal to them. So, asking, how do you wish it worked? Or, what would that be? Is that something you can relate to? Or do you know somebody this has happened to?
Sure.
All of those kinds of things are general, but yet, trying to ask an open-ended question that encourages discussion.
Yes, and that you can learn from in terms of what they need. Absolutely. Now, I think that you have a gift for the audience that relates to conversations with clients and customers. Is that right?
Yes, I do. We have in our Business of Nurse Coaching course, we have one of the workbooks. Workbook 2 is on customer conversations. And it's about, understanding your target audience, the challenges, their experiences, all of those things, and helping you develop that. So if you went to inursecoach.com/biz, B-I-Z, gift, B-I-Z-G-I-F-T, certainly you can get our workbook to help you with that process.
That sounds wonderful. And to make it even easier for them, audience, all you need to do is just click the button below this video, and it's going to take you right to that URL that Karen just gave you. So, and then you can download the workbook. So again, it's the Business of Nurse Coaching Workbook on Customer Conversations.
That's right.
I'm sure that's going to be of value to the listeners who are interested in this topic that we're covering today. Well, thank you, Karen. Is there anything else you'd like to share today before we wind up?
I think this is a really valuable experience. I think having a mentor in business, someone like Sharon, would certainly be advantageous to help you through all those stumbling blocks you might come across. Starting a business does take time and energy, but you have to stick with it, and it can be a very rewarding experience in the end. If anybody has any questions, certainly can feel free to contact me at academy@inursecoach.com, or visit our webpage at inursecoach.com to look at our courses and offerings.
Wonderful. I encourage everyone to do that. There's besides the nurse coaching, I just want to say that besides the basic nurse coaching education, you also offer continuing ed courses for
We
nurses there
do.
that are
Yeah.
rich and very much related to there were skills development courses. So you come
Yeah.
out with new skills that you can apply in the marketplace in your business.
Nurses, coaches want more. They've, tasted what nurse coaching is, and they said, I really want to know more. We need, courses on, so we do have a course on cannabis nursing, certainly, which is a new area of nursing practice, and not that we're selling or providing products, but we're helping people make decisions and advising them on, and educating the nurses certainly on its use. We have, of course, the business of nurse coaching. We have end of life coaching, because certainly area that has great interest, and as well as functional medicine for nurses. And functional medicine is looking at the root cause of disease and not doing symptom management, which is really our traditional medical system that we have now. So they're really very, very well taught, have to be honest. The instructors are phenomenal, also providers of that care. So visit at inursecoach.com.
Wonderful. Wonderful. Well, thank you so much for being here today with us, Dr. Avino. I really appreciate your presence and your experience and all the cases, the examples that you shared with us. Thank you for attending. To the audience, thank you for attending today. And I look forward to being in touch with you through emails that you'll get occasionally from liberatednurse.com. You've been listening today to Sharon Burch and Dr. Karen Avino for the respectful marketing tips for caring nurse entrepreneurs. And remember, you can watch the recordings of this series through Sunday, September 18th, and then they will come down. The recordings are not for purchase. You cannot get them after the 18th, so be sure you watch them all before then. So thank you again.
Thank you, Sharon.